My name is Alexa Clay, and I'm a student nurse midwife at Vanderbilt. Last year I served as student representative for the student issues section of the ACNM. ACNM is the professional association for certified nurse midwives and certified midwives in the United States. It's also the oldest women's healthcare organization. And being the student representative gave me the opportunity to meet with students all over the country from different programs, and throughout the year we met through webinars and talked about what was important to us in midwifery and how we wanted to stay involved in midwifery leadership after we graduate from our programs. The students in our class elected me to be student representative to the student issues section of the American College of Nurse Midwives. And because I was our student representative, I was able to meet with other students across the country through the computer, through webinars throughout the year, and to talk about our experiences as students and what we found important to us in midwifery education. And we were able to share what aspects of midwifery education we'd like to be involved in when we graduate. And we also were able to survey the students within our own individual programs and to find out what aspects of our programs we loved and what aspects we thought needed improvement. And we compiled the themes in those surveys, and in May we all met together during the week of the ACNM conference, and we compiled a report to give to the college. We did a PowerPoint presentation, and we stood up in front of about 1,500 midwives and told them what we appreciated about our programs and what areas we saw that could improve. And I was able to be one of those students to speak in front of the midwives, and it was really exciting. Because of my involvement in the student issues section of ACNM, I got excited about being involved in ACNM and wanted to serve in a different capacity this year. So I decided to apply to be part of the ACNM Virtual Quality Institute, which is a volunteer project that is part of the ACNM Division of Standards of Practice. In the ACNM Virtual Quality Institute, about 30 midwives and midwifery students are working side by side to review modules that already exist for healthcare quality improvement. And we're looking at how midwives can adapt and adopt those modules so that we can also be a part of quality improvement. Larger hospital systems are being pressured to improve on quality and to participate in quality improvement activities. And midwives are the perfect people to be at the table because we're very much committed to evidence-based practice and to improving the quality and the outcomes of our patients and our clients. I didn't realize what a great organization ACNM was, and I like that the American College of Nurse Midwives is really grounded in some core values, and a couple of those that really resonated with me are that they're women-centered and evidence-based. Being able to be a midwifery student and being involved in ACNM allows me the opportunity to interact with midwives and midwifery students across the country and really across the world too, that are committed to an excellent standard of midwifery, and also that are committed to promoting midwifery as the standard of care for all women. Last year for the ACNM annual meeting, I and the other student reps were involved in creating a student host program so that students wanting to come to the annual meeting from other places didn't have to bear the burden of hotel costs and could actually stay with other students and talk to them and find out about their programs and share their experiences. And we also created a room at the conference that was just for students that had food and a place to sit down and chat and get to know each other. Being involved in activities outside of our midwifery program, like being involved in ACNM, has really given me the opportunity to see the bigger picture of midwifery and to be inspired by women that have gone before me and men that have gone before me and that are doing amazing things for women and children and babies. And also I'm really interested in midwifery education and in mentoring future midwives, and being able to be involved in ACNM has, first of all, it's given me It's given me access to midwives that have become mentors to me and that are becoming mentors to me. It's also allowing me the opportunity to speak with newer midwifery students. Being involved in ACNM is giving me ideas of how I might like to be involved in leadership in midwifery when I graduate. I'd really like to be an educator. I'd really like to mentor future midwives. I'm really excited about where midwifery is going, and American College of Nurse Midwives is a concentration of women and men who are also equally as excited about where midwifery is going and are going to take it there. One unique thing about the Vanderbilt Nurse Midwifery program is that our faculty is involved in leadership in midwifery. When I open up the Journal of Midwifery and Women's Health, I see journal articles that are written by our faculty. We have faculty that are involved in midwifery change, in every aspect of midwifery you can think of, and it really inspires us as students to also be involved. Our faculty respects us and respects our opinions and wants to hear them. And I feel like the education that I'm getting here is empowering me to be a leader and to be involved and to have a say and to make change.